Hello, everyone, and thank you for joining us today. I am Sonal Arora, the co-founder of Six Meal. And today we are going to talk about something which is considered no less than a taboo in our society. Yes, I'm talking about mental health and its consequences. But I think it's high time we talk about it, especially during the current times, which we call the new normal. And did you know the Indian Psychiatry Society, according to the statistics of Indian Psychiatry Society, about 20% of mental health patients dealing with depression and anxiety has increased since the lockdown of March 2020. And today we have a very special guest with us, Dr. Kislaya Dhar, who will talk to us about the mental health issues on individuals, especially during this pandemic, as she deals with them on day-to-day basis. So let me just invite our guest. Hello, Dr. Kislaya. How are you doing?
Hi, Sonal. I'm good. How are you?
Good. So, yes, we can hear you loud and clear. So, let me begin by asking you, firstly, what do you think are the biggest misconceptions when it comes to mental health?
Okay, diving in, there are lots, but I will address the main ones which personally bother me as a practitioner and I see the maximum of. First and foremost is the stigma. Like you said, it's no less than a taboo in our society, still in our culture. You're labeled pagal, या फिर वो बाबा बन गया है, संन्यास ले लिया है, and nobody wants to talk about it, nobody wants to address it, and if somebody has it in their family, they will seek treatment, but in secret. It's not something that's openly talked about, which kind of normalizes these things. Second would be the misconception that it's not treatable, it's not curable. It very much is. And third, and this I get from a lot of patients, Dr. Saab, iski aadat lag jayegi, ya addiction ho jayega. And I have to get into the whole thing of why you need medications, and that's a need and not a dependence, which is an addiction. So no, definitely there is no addiction to psychotropic medications. It's only helping you get better. And yes, some illnesses are curable, some illnesses are treatable, but they're all definitely manageable to improve your quality of life.
Sure. And I'm sure there are a lot of questions related to mental health, which our viewers would also like to ask. So let me just put it out there that let's have this discussion. And at the end, we will take all the questions and doctor would be happy to answer all the questions. So just reserve your questions for the end. So my next question to you would be that what do you think are the most tangible and intangible effects of mental health issues?
Let's divide that into mental wellness and mental illness. So the most tangible side effects of mental illness are the ones that you see. Somebody is not interacting, someone's not behaving the way you would expect them to, and they start withdrawing or you start withdrawing. You see a perceptible, tangible change. And then this follows in your social life, in your relationships, your personal life, and your work, professional life, in terms of the financial effects of it, whether you're able to keep down a job, whether you're being paid less than your peers because you're taking more leave, or you're not even getting a job because of this particular history. And then, of course, your personal relationships start getting affected, and so on and so forth. It's a ripple effect, Sonal. I mean, you know as well as I do, you're a family person. You know, the way you treat your husband, then he goes and takes it to somebody else, and at the workplace, it just goes on. And then the intangible ones are, of course, the distress that the patient is going through. And like we were just discussing, you know, it's a ripple effect. So it affects everybody around you and how they take it forward, how they perceive it, and how they tell other people or teach other people about mental health.
Sure. So, what do you think are the early signs of depression that one should look out for, whether in friends or family?
Right. So, clinical depression off the offset, you know, people notice a certain change. Humne noticed kiya, but we didn't remark on it because it was nothing worrying. So any low mood, any change from a normal pattern, you know, temperaments are different, personalities are different, but any change from the normal lasting more than 2 weeks in anyone that you know, near and dear ones, acquaintances, I don't think it harms us to just go and ask, are you all right? Do you need help, or do you need to talk? And you don't have to be the person to listen to them. You could just guide them in the right direction. So any alteration in sleeping habits and eating habits is what I tell family members, because they would observe it. And amongst your friends with whom you may be not spending that much time, but the way you are connecting with them, suddenly, you know, a positive person has become very negative. They notice only the negative in the world around them. or they were very communicative, outgoing people, and suddenly they don't want to go for any outings at all, and they want to sit at home and like, I'm just like this, leave me alone. These are changes that we might be an indicator of someone going in for clinical depression, and you need to get them to help.
Sure, I think that makes a lot of sense. So do we think, we always think that mental health issues are only something which adults or people with a certain age would have it? Earlier, people used to say only old people who are not doing anything and are staying at home, अरे
Yes.
उनको depression हो गया है. But
हाँ.
we see anxiety, uncertainty so much around us, and of course depression. So is there an age group or an age limit that we should look out for, or all age groups can have it?
All age groups unfortunately can have it. I'm really glad you brought up that stat from the IPS, because it's not just young, like you said, it's not just the elderly, young adults, and now even younger and younger. Childhood depression is a thing, childhood bipolar disorder is a thing, and now we are seeing more and more anxiety disorders in children because of multiple factors are there. Psychiatry is a branch of medicine, but the model of disease that we follow is biopsychosocial. So there's biology, there are social factors, and there is your personality and or your own psychological makeup. All three come together to push you into disease or keep you just functioning barely, but you are on the brink. You know what I mean? So there is no age group. Please don't hesitate. It's a teenager and ये तो ऐसे ही होता है, कमरे में पड़े रहते हैं, and you think it's normal. It's not. You might want to take them for help. And even for the elderly, like you said, culturally, again, this is coming from the social setup कि retire हो गए हैं, अकेले बैठे रहते हैं, बात नहीं करते, वो तो ऐसे ही हैं, अब वो जाने वाले हैं. No, not at all. They might be in clinical depression. If you treat them, you might recognize the person that you used to know, your parents or grandparents, and they'll have a better quality of life.
So children also, I know that personally you handle a lot of kids as well who are going through depression, clinical depression, anxiety, such kind of issues. So why do you think that the number of children dealing with mental health issues has increased over the past few years, especially in metropolitan cities?
It's not really increased. Let's, in terms of anxiety disorders or being exposed to the, changing content on social media and more interaction, the world is coming closer. Yes, the exposure is more. The good thing about actually diagnosing more people is that they're coming to your notice and they're coming for help. As you said, in the metros, there is a little more awareness. Parents are more aware, and woke parents, as we say, wo jaldi aate hain help ke liye, which I think is a great thing. And the numbers increasing might have to do with, again, societal factors. Our structure of family is changing from a joint family, large support structures, to more and more nuclear family, more and more competitive environments for children. And like you said, I work with children. I enjoy working with adolescents because you realize half the problems are man-made. And you could probably just address those, and they don't really need to be on medication, which is another reason I encourage people, there's no shame in going to a psychiatrist or psychologist or support structure. Get to the mental health care system and the team and get the right advice.
And Kislaya, most importantly, what we are dealing with right now is a lot of uncertainty, a lot of anxiety, I think in every household, right? We are living in this new normal that we all have started calling it, that this is how life will be for a couple of months or a year, we don't know. So, and people feel that they are very fearful right now. I'm talking personally through my own experience, that you have a lot of anxiety and you are fearful whenever you have to get out of the house. There's so much of effort that you have to make. You have to wear your gloves, you have to wear your shield, you have to wear your mask, and still there is so much fear inside you. So but somewhere you are scared to say it aloud because you feel that you'll be judged. So what do you think about the current situation, especially?
You've hit the nail on the head. That's exactly the current scenario. And like you said, it's unpredictable. The uncertainty adds to the anxiety. Ki 2 mahine chalega, 2 saal chalega, we don't know. There's no end in sight. And as I say, hope for the best, but prepare for the worst. You actually picked up on a very good point, Sonal, that we are scared of mentioning that we're scared. You have a fear of actually coming up with the fact that we're all afraid, and we are all afraid. It is a time of anxiety. It's not a holiday. It is a pandemic. It is something serious to be taken seriously. So, and this ties in with the thing I was saying about stigma, this being ashamed or being afraid of actually discussing your emotions. We should know how to identify them and be able to discuss it. This is why support groups work so well. I know you're a new mother, so if you had 5 new mothers to talk to and discuss your anxieties, that makes you feel better, and which is how new friendships happen, with changing times in your life. And I don't think fear is a negative emotion, honestly. If it's modifying your behavior in a positive manner to avoid a risky situation, which is what we're all afraid of, then it's a good emotion. Unless it's going overboard and becoming a clinical problem, or you're not able to function at all, or you're becoming paralyzed with fear, as we say. So till the time that, you're washing your hands, you're using the sanitizer, you're putting the mask and you're putting the shield and you're going out, that's great, man. Change the behavior in accordance with the times. That's what life is all about.
And not live in this fear and make yourself even more miserable.
Of course, as long as it's modifying your behavior in a positive way, it's a good emotion. And like you said, because we're unable to discuss it or talk about it, it becomes more and more in your head. But if you're able to handle it in a more rational manner by just talking to 5 more people, like, you're not alone. Everybody's going through this. And you're right, it's in every house. It doesn't matter where you come from, what size your family is, what size your house is. Everyone is in the same boat. Someone's loved ones are with their, in their house. You have elderly, you have children, you have to be bothered about them. Someone's children are far away, they are stuck alone. Unka bhi chinta karna hai, apni bhi karna hai. So it is a time of stress.
So how do you think this new normal is affecting people and society at large?
By and large, I think the behavioral changes are very good. It was a long time coming in India. Please don't spit in public. Please don't stick to each other. We're constantly pushing people, so that's good. The bad thing, I feel, there's a negative to everything, is what you picked on, the fear. Hum itne zyada dar gaye hain that we've forgotten to be kind. We really need to remember, is this what you want to teach your children? That when you're afraid, you shun the people in the same society jinko agar theek hai, infection nikal aaya hai, to unke ghar nahi jayenge ya koi nahi jayega. Take your precautions, but do your human duty. And that is how society as a whole functions, right? It's an unwritten contract.
True.
So there are positives and negatives, and depending on each.
And like you said, that parents are so paranoid for themselves and for their children around. And so like you said, mentioned right now, that the parents are so scared that they pass on that fear to children. And sometimes the children are very small in the house. For example, I have a small baby in the house, and somewhere unconsciously, I think I would pass on the same fear to my child, or even a 4 or a 5-year-old child passing on that fear. And unconsciously, they are also dealing with something which they are not used to.
Yes, so, in fact, good example. So let me reassure you that to a baby, you're not going to genetically or by your thoughts transfer the anxiety. It's not going. Your child isn't going to become an anxious baby. But for older children, yes, this is a good point. Anxious mothers make anxious babies, children, and they're processing things on their own. The clearer the conversation, the more open the atmosphere in a home, both children and their parents do better, I feel. As long as a child is able to come to you and ask why not, or why this, or why are you so scared, that conversation needs to keep going, which again ties in with our embarrassment or our reluctance to discuss emotions as a family. So please rest assured, just because you're anxious and afraid, you're not making your child ill. But yes, if that anxiety of yours and changing behavior in you is giving your child a role model to follow and be careful on their own, that's great, right? That is what you're trying to teach them anyway. If you can do it without fear, that is great. The more relaxed you are, the calmer you are, the more rational, I believe, you are in explaining those things to the child, the more they even follow your instructions.
Sure.
Children are very curious. You can't just tell them, don't do this, and then do it yourself. They will do what you do, not what you say.
And also in the current times, I think it's very important, like you said, communication is very important with all age groups, whether you're talking to children or whether you're talking to your older parents, because older parents are equally fearful right now and scared. Like small children in the house, because everybody is telling them if you're 60 plus you should not step out of the house. If you have heart diseases, or if you have any kind of metabolic diseases, you are
Yes.
at the radar of coronavirus. So they are equally very scared.
Yes, in fact, you raised a good point. Yesterday itself, I had a patient. I wouldn't even call her a patient because there's no diagnosis. It's just an acute, stressful situation of, like you said, I have to keep shouting at my parents because they insist on going out because it's everything is unlocking. On the other hand, I have my child whom I have to protect, and I can't go out, and I tell them not to go out because they don't listen. They come with their own mindset. And you have your in-laws who are so frightened they won't even leave the room. And I don't know what to do. So she was stressed out about that. But like you said, it's important to communicate clearly. Why are you afraid? What is your expectation? What is their expectation? If someone isn't taking it seriously, why not? And if someone's letting their fear paralyze them and they're hiding in the bedroom, making functioning in that house almost impossible, what can you do to alleviate that and address it? And practical solutions to everything exist.
True. And Dr. Kislaya, talking about women in particular, they are juggling with a lot of things right now, because in a lot of houses there is no staff coming in because people are scared again. So women are juggling with household work, cooking, cleaning, and looking after children. And if they are working mothers or working individuals, then they have that to look after as well. So they somehow, women especially, are feeling that we are losing it right now, and they can't find their bearings.
You're absolutely right. And trust me, my heart goes out to all these young women, especially new mothers, with a 3-year-old or a 5-year-old, and in-laws and parents and husband, and working from home and having to do the household chores because your help isn't coming. And it is a very, very difficult position to be in. Fortunately, some of them have partners who kind of help out. A lot of them don't. And this is, like you said, this is the new normal for these ladies, and they have to find their bearings, and they have to kind of remain calm for the child, take care of the elderly, make sure everyone's getting their medication and their khana on time, and finish their work. These households are running on 2 incomes, and you can't take the chance of just giving up your job as well. So in that case, like I tell my patients, I will tell you, and I hope everybody listens in the audience as well, discipline and routine play a large part. The more you can structure your day, and if you have enough space in the house, it's very important to have some space just for yourself. As much as we are thrown together, and it's nice to have this family time that everybody keeps saying, "Arey, sabko time mil gaya hai, saath mein baithne ka, we didn't get this time earlier." It's important to take out time for yourself as well and sort of recharge. Have those 3 hours of work jahan koi disturb nahi karega, leave the children with the grandparents or manage it that way. Request your partner to help with the household chores, divide it. Tell your children to do the chores. I've been telling ladies, they're hesitant ki itna chota bachcha kaam karega. I'm like, it doesn't matter, uska kaam hai. It is not too much work to ask them to pick up their stuff and put the toys away, or make your bed, learn how to fold your clothes and help out. And they'll start enjoying it because, like I said, children will do what you do. And that will help you. So routine, structure, discipline for everyone in the house. And if you have to shout at everyone, you know what, I don't care. You are important right now. You have to maintain your balance because you're literally running the whole house. So get everybody into that discipline. ये नहीं हो सकता है कि somebody's waking up at 7, you're making their breakfast, someone's waking up at 10, you're making their breakfast, someone's waking up at 12 and you're doing the same thing again, and then the whole day goes away. If you know what I mean.
Yes, absolutely. So talking about cooking and food and things like that for women, mothers and families, during this lockdown, another thing which has come in the forefront is that people, their eating habits have gone haywire. There are two sides of it. One is because of the pandemic, everybody is talking about health, and everybody is talking about how important it is to keep your immunity but intact. And to boost your immunity, you have to do different things and drink different kind of kadas and this and that. And on the other side, there is also a lot of junk happening, a lot of snacking happening in the house, because you're working from home, you're sitting in front of the computer, all you're doing is probably eating a lot of junk. And children are at home, they have nothing to do, they can't go out and play. So the only thing the parents can do for them, okay, fine, eat what you want to eat, or eat what is basically not good for you, but if it makes you happy, we'll give it to you. So what do we
Yeah,
do
anything
about
to
that?
get through that period. You're
Yeah.
right. So, like you said, there are two sides to it. The good thing is that people are becoming conscious. I hope everyone's doing it a little scientifically, because food fads come and then they harm themselves and they don't really look for scientific information. And the negative is that, yes, not just placating someone ki ye kha lo to khush ho jaoge, ya fir leave me alone for 2 minutes, go have a chocolate. They don't have
Yeah.
time to cook healthy foods, which is where a nutritionist would come in handy. Easy recipes for just making something really fast, which is also healthy. It's important. And as you were asking, it ties into mental health in a big way. Most people are not aware of it, and this is also an emerging science on its own, nutritional psychiatry, as we call it. The effect foods have on your mental health. We've known this, this is again cultural knowledge that we've had, which we've kind of forgotten. Or दादी माँ के नुस्खे जैसे होते थे, तुलसी का पानी पी लो या हल्दी का दूध पी लो if you're ill. It also ties in with your health. All of us know coffee wakes you up, and green tea at night will put you to sleep. So these things are tied into mental health as well. Here, I think it's very important for people to look out and remain on a healthy diet. Anybody prone to a mental illness with altering diet, you can push yourself into eating disorders, you can push yourself into depression, you can push yourself into obesity, which in itself is a whole systemic disorder of its own, right? So nutrition is important. We need to look at it. It's not very easy to find information always, but if you go to the right places, it's not hard, and it can make your life easier.
So Dr. Kislaya, about Six Meal that we run, and we talk about healthy food, and we customize meals as per one's dietary requirements. So, of course, I personally believe that if you're eating healthy and if you're eating balanced food with the right proportion of vegetables and fruits, and less of sugar intake and less of caffeine into your system, it helps in your overall well-being. But talking specifically about mental health and talking specifically about calming yourself down during these times, how much do you personally, as a doctor, associate with it?
Sorry, I lost the last part. How much would I?
How much do you personally, as a doctor, associate with healthy meals for
Okay.
individuals?
First of all, let me give you a shout out. You did a great job with my father-in-law, which is how we met. Six Meal is, I think, one of the few nutritional, actual nutritional science-based diet projects that I've come across. And I found it very well balanced and tasty because I tried it myself. Coming to the second part, as a doctor, I would highly recommend it. As a person, I'm very lazy, and I must admit I don't cook myself. So meals are not always healthy. And the third part, time into mental health. I actually have a little board, if you guys can see it. Otherwise, we'll do it verbally. Can you see this, Sonal?
Yes, yes.
Okay, so just
actually put you on
using it.
I'll put you on a full screen. So, yeah.
Sure. Okay. So let's see. Depression, I'm using just as an example. It could be any mental illness. Specifically in depression, you have something called carbohydrate craving. It's a symptom. It's a sign of the disease. You crave sweet things and high caloric value foods, which means you end up having a lot of fatty foods and junk. Now, this is something Sonal and I have actually discussed about, if you remember, which causes weight changes, right?
Yes.
Now, weight changes, of course, has its own health effects, as we were just discussing obesity and other things. That apart, it affects your energy levels. Now, for a patient of mental illness, this is very important because your energy levels will decide how much work you're doing or how lethargic you're being. And once your weight starts changing and your energy level starts going down, your self-esteem and confidence are affected. And this is a cognitive part, the thought part of your mental illness. There is a mood component where you're sad. And there is a thinking part where you're not able to think positively. But if your self-esteem is low, how will you think positively? And your therapist will have to do that much more work. This may worsen or at least not let your depression get fully cured. And you become lazier and more lethargy builds up, right? So you're not motivated to address your food concerns even more. This becomes a vicious cycle, which is why I feel food has a very important role to play in mental health and other diseases as well. Hypothyroidism, there are foods which enhance your metabolism, which in hypothyroidism becomes low and you have weight issues. which pushes you into clinical depression, which happens with hypothyroidism and obesity as well. So that was just a small example. I hope it's clear.
Yeah, I think it makes a lot of sense. And also, coming to food specifically, if just you had to give few examples of the kind of food items or ingredients that people should use in their everyday household to just keep themselves a little bit calmer, what would they be according to
Okay.
you?
You've asked a very technical and difficult question in a very simple manner. This is a whole topic of its own. We have lectures on this. Secondly, you are the better person to answer that, being the actual nutritionist here. And
Yeah.
but to just like in households, dry fruits I really encourage. They're called brain fruits for a reason. And in this time, like you said, people are focusing on junk food. You're afraid of ordering out, or you're not getting the time to cook properly, or you're not getting all the ingredients.
Yes.
Micronutrient deficiencies and essential amino acid deficiencies are on the rise. In the past
Hmm.
week itself, I've had 3 patients with vitamin B12 deficiency and vitamin D3 deficiency because aap dhup mein nahi ja rahe ho, and your calcium intake or vitamin D3 intake is not there. So foods, dark green leafy vegetables, which are high in vitamins, ये आपके घर में
Yes.
होता ही है. हमारे यहाँ पालक and you have salads. If you could have more of salads and more of fruits, you'll protect yourself against this to a large extent. I'm not sure if people have, okay, they have a habit. जो चाय पीता है वो चाय पीता है, और जो कॉफी पीता है वो कॉफी पीता है. And these are very difficult to break because personally I'm a caffeine addict. It is at the level of an addiction. If I don't get my coffee, I'm not waking up, my brain is not working, but it also makes you anxious and it affects your sleep. So similarly, like the circle I was showing you, if your sleep is affected and your appetite is affected, it affects your overall mental well-being. So someone who's not getting adequate sleep or is generally feeling very anxious, I would strongly advise cut back on your coffee, add teas, any kind of tea, preferably without milk, green tea, black tea, that will help you more.
So
Anything
it
you
is
have
a
to add
kind
to
of,
this?
yes, absolutely. I definitely agree with you, and we believe in it, and that's how we actually started our company Six Meal, because we feel that it's not food is what you're eating is what you're is an inside out the entire system, right? So how you feel is what you eat. If you're feeling very lethargic, if you're feeling like how in olden times people used to say that in the afternoon, if you eat white rice or if you eat a lot of white things like maida and other things, you feel very sleepy. Now, if somebody has a plate of chola bhatura in the afternoon, he'll definitely feel very lethargic and he'll feel sleepy, because it's a direct
Of course.
impact on your health, mentally and physically. So I think from time immemorial, we all know that certain things which are not good for our health, everything white, we should definitely keep out of our kitchens. White sugar, maida, white breads, we should try and keep them as away from us as much as possible. And of course, a lot of colas and a lot of drinks, we all know they are not good for health. And like you mentioned, caffeine is not our best friend. But yes, of course, some people are addicted to it. So if we cannot remove them completely from our diet, we should at least try to cut them down, especially during this time when we are locked in and the anxiety levels are very high. And lastly,
Yes.
I would like to ask you one question, that when we talk about clinical depression and we talk about medicines related to it and antidepressants, that is something which is a big phobia in our society, that if somebody goes on antidepressant medicines, there's something seriously wrong with this person. Also, another part to this question is that a lot of people say, and I think I somewhere it is true, that with antidepressants you put on weight. That's your side effect. Is that true?
It is true. All medications have their side effects. It's not necessary you'll put on weight if, along with your psychiatrist, you work with the team of nutritionists and dietitians. That is why, before discussing every medication, depending on the person who's coming to you, there are people who've lost a lot of weight. So we use medication which increases your appetite and increases your weight. And the other SSRIs which are commonly used, do cause some weight gain because they increase your appetite. That is their job as a baseline antidepressant, because appetite changes in depression. So you're right. But none of this is a reason to not take medication, right? And the first part of your question, side effects are of course there. It's not that you'll be taking them for life. There are very rigid guidelines in place. First episode, 6 months, second episode, a longer period of time. And if somebody keeps having recurrent depression, then you're on a medication for life. But you're on a medication for life in diabetes and hypertension as well. So I really don't see why you stigmatize one and take the other.
Yeah.
You would go to a personal trainer for your physical health. So why would you not go to a therapist or a psychiatrist for your mental health, which affects everything? And if you don't mind, I'll take another few seconds because
Yeah, please.
Sorry. No, when you were talking about the food, I just remembered not just the mood, Sonal, the memory and all is also dependent on foods. This is recent research. Like I said, it's an emerging science. There is recent research done in humans and animal studies, which have shown that obesity in midlife makes you 2 times more likely for dementia in later life. And when you're hitting your latter years, increasing blueberries, increasing dry fruits, vitamin E, omega fatty acids actually improves your memory and cognition. So it's not just mood, it's your brain, and your brain is running your body. So
I completely agree with what you're saying, actually, because whenever people come on a 1 week kind of a detox plan or a diet with us, which is basically focused on a lot of vegetable juices, focused on a lot of salads and fruits, and very limited whole grains, and no meat and no dairy. And they do it for 5 days. That's a special plan that we do for people. And there are so many people who come back to me and say that during these 5 days, they felt very energetic. They felt very with themselves, if you know what I'm saying. Yeah. So those 5 days, apart from losing weight, which was their main criteria, I think the other thing that they realize is that because they were doing so much of clean eating, that they felt not very lethargic, they felt very energetic, and they felt that they could focus on things properly, which is your point of memory.
Yes, and it's not just the content of what you're eating, it's also the timing and the caloric intake.
Yes.
Right.
Yes.
So there are like 4 components of food, not just the content, but the time you're eating, the amount you're eating at which particular time, and then lastly, the colors of the foods and the way you're laying out your plate and the emotional effect that is having on you. So yeah, I think this 5-day plan sounds really good. Maybe that will motivate more people to take you on and actually do something for their health.
Sure. Thank you so much. I think it was great. So now let's take few questions which people have been typing in. So there's one question where a lady is asking Diksha, how big is the problem among children and adults? According to you, how big is the problem right now?
You mentioned the stats. There has been an increase, 10 to 20% increase in people who earlier would have just been prone to anxiety or depression, but never slipped into it clinically, who are now in it clinically, who need help with not just medication and social support and therapy. So the problem is increasing. There are many factors which go into this. Not everybody who is prone to it or has a family history will develop a clinical disorder, and vice versa also. Not everybody who has never had any family history or past history will remain okay during lockdown. It's a special circumstance. This is why we call it a force majeure. It's literally an act of God.
Sure.
So it is a big problem, but I really hope with more awareness, people will reach out, and we won't let this become the next epidemic, a mental health problem.
Absolutely. Another question here is that there's a person who says that due to anxiety and stress, I get acid reflux and I can't get rid of that. So what should I do?
2 things. One is, of course, medication. Second is, of course, your diet. Sonal was mentioning, आप दोपहर में छोले भटूरे खाओगे तो not only are you going to feel lazy, you will have more acid production and acid reflux. So avoiding fatty and heavy meals at night, head end elevation of the bed, and thirdly and most importantly, actually maybe talking to someone, not always a therapist or a psychiatrist, a counselor, your friends to actually allay your anxieties, bring down the fear level, because that increases your bodily secretions and reflux.
And here another question is, what if we want to get out of the negativity, the spiral of negativity during this environment, and during this time we can't even run out of it because we are locked in. So we get into a spiral mode of negativity. So
Yeah.
what can we do about it?
I really hope you're not logged in with someone that's giving you the negativity. And you're right, you can't run away from it. So the most important thing is to change your own mind, but we have to train our minds the way you train babies. People think that your personalities and thought processes are rigid. They're not. The brain keeps growing. Your thought process keeps changing. Who you are keeps changing. And I know it's very easy to say and very, very hard to do, but there are things that you can't do anything about, Sonal, right? So there's no point in worrying about it. Agar barish ho rahi hai, to barish ho rahi hai, aap chhata le lo. That's the only thing you can do about it. So unfortunately, yes, you can't run away. Please don't try to run away also right now in a lockdown and a pandemic on. Train your thoughts to be more positive. There is a silver lining to every cloud. I firmly believe that, and I have seen it. I've had patients come to me with very, very difficult circumstances, but we found one thing for them to latch on to and build their life around that. And if you still have difficulty, please, please, please reach out to a professional.
Yeah. So, in fact, somebody's question is, how important is counseling nowadays? If they are feeling this and they
counseling
are
is always important. Yeah. Okay, counseling is always important. Again, maybe I have a bias because I work in the field, but I think everyone should undergo therapy for at least a few months, if not, or at least go for 6 sessions. You get to know yourself better, introspect, get to know the problems around your life. Maybe the problem isn't you, maybe the problem is someone else. But how do you deal with it? You're not going to leave your family. You're not going to run away from your friends, right? So, and especially specifically about lockdown and the COVID fear, counseling is important in terms of getting the right information. Like Sonal and I have had a somewhat scientific discussion about food. It's important to have a scientific discussion about your fears and your mental makeup. Just because COVID is out there doesn't mean you will get it. There is possibility, there is plausibility, and there is inevitability. If you're not being careful, if you're not taking the precautions, inevitably you're going to get it from someone, and you're increasing that stress in your mind.
Yeah.
Again, I will repeat the same thing. If you're not able to do it with yourself, with your friends, with your family, please reach out for professional help. You're not going to try and fix a broken bone on your own.
True. In fact, some people also want to ask you personally, doctor, that if they want to come for a counseling session and they want to have a telephonic session with you, how's that possible? So I guess we can definitely give your details to them and they can directly get in touch with you, right?
Sure, we can do that at the end. We can handle more clinical questions right now, and I'll leave my details at the end of the session.
Yeah, because people, I think, also feel that during this time they can, if they have somebody to talk on the phone or they can have a video call, they'll be more at ease when they hear a doctor, a counselor telling them that there is nothing to worry, and like everybody else, they'll also say
true. So yeah, that is very true. Sometimes it's better to hear it from a professional. Even though your family members might be saying the same thing, it has more of an impact. You're absolutely right. In that case, I would strongly recommend people reach out to the support helplines. There are various people offering that information and support. NIMHANS is running a program right now, Pan India. There's the Institute of Human Behavior and Neurosciences in Dilshad Garden, our own Delhi, which is also running a support helpline for everyone who can call in with your queries about COVID, your queries about how to behave at home and outside, what precautions to take. And if you're having mental health issues, they will tell you where to go and how to go about it. Of course, I'm always there, but even I'm human, so I won't be able to answer all the questions. There are different sources for different kinds of information.
Sure. So the next question I think I can take up. Somebody's asking, we want to know more what is 6 Meal all about. So you can definitely go to our website and have a look. But just to give you a gist, we actually cook meals and send it to your house as per your dietary requirements. So we do meals for weight loss, for diabetes, for thyroid, PCOD, and different kinds of health issues. And like Dr. Kislaya said, that we do balanced meals for even people who are dealing with um, any kind of anxiety or any kind of depression issues, because the food that you eat also plays a very, very important role, like we discussed. So you can definitely reach out to us on our website or on our social media handle, and we can help you better. So thank you so
You
much.
missed
I
out the
think
most important part, Sonal. Like tasty food. It's not just balanced.
yes. So we have somebody who gives her thumbs up to the quality and the taste
Recommendation.
of food and recommends you our food. So Dr. Kislaya has been our customer as well. So she's been a very happy customer. Her entire family has taken food from Six Meal. So thank you so much for joining us today. And it was a great conversation. I think we all are feeling much calmer, and we all feel that we will sail through this. We just need to be very focused about what we are doing, and have, like you said, have a little routine in our lives and not completely
Discipline,
go
discipline, discipline. It'll get you through everything.
so discipline is the key, guys. So like doctor said, discipline yourselves, whether it's about eating or working or looking after your children. Everything will fall into place, and hopefully as humanity we'll all go through this very, very soon, and we'll be back into our normal lives soon. Thank you so much, doctor. It was great. Thank you so much. Bye.
Thank you. Yes, it was. I have shared my details. Please feel free to share that.
Yes.
And I would love to hear from people.
Thank you so
Okay.
much. Bye.
Leave now.
Yes.
Bye, everyone. Take care.